Welcome back, dear viewers. Today we are pleased to welcome Dr. Mohammad Tarakmeh, an ENT specialist, to discuss two common issues that affect many children and adults today: recurrent tonsillitis and fluid buildup in the ears. Dr. Mohammad will help us to understand the causes, symptoms, and treatment options for those conditions and share valuable advice for parents on how to protect their children's ears, nose, and throat health. So, welcome Dr. Mohammad to Good Morning Kuwait.
Hi, good morning.
And we are pleased to have you.
Good morning, it's my pleasure to be here.
Well, so let's start our discussion with what are the most common causes of recurrent tonsillitis in children and in adults as well.
Well, the most common causes are like viral infections or bacterial infections. Either bacteria or viral. 80 to 85% are viral infections. Usually we don't need to use any antibiotics for the viral infection.
Yes.
For the bacterial infection we need an antibiotic. So this is the most common two causes of infections of the tonsils.
Okay, so as you know that we have, let's say that before we reach to the cause, what is that? Let's say that when we consider a recurrent for the tonsillitis and require medical intervention, as you know that traditionally we have the elders, our mothers, grandmothers, they used to have the child with them between their legs and they lift it up with their fingers.
No.
But how about medical?
I wouldn't do it. I wouldn't do it because it could be dangerous sometimes.
Yes, sometimes.
If there's an infection with abscess collection and inside the tonsils or behind the tonsils, it may be very, very dangerous. We can pull them up,
Yes.
and we can could expose the fluids in the tonsils, and the patient can aspirate from these fluids.
Yes.
So we have to be very, very careful during treating this infections. So it's very important to treat these infections. Usually we have to manage. We see what are the symptoms of this child. In case of fever, we have to give him like painkiller to reduce the fever, to reduce the pain. Fever like more than 38.5, 39 degrees, we have to give the child the medication.
There are some parents give their children ice cream, popsicles, just to cool.
Yes, after surgery, but not during. Not during an infection. So. Cold drinks, yes, but not ice cream. I wouldn't do. So I wouldn't. I would see the patient in the clinic, and if the fever is not getting better, like within 1-2 days,
yes,
you have to seek your doctor just to check if the infection is like bacterial, with abscess, with bacterial infection on the tonsils. So we may need antibiotic.
Exactly.
So so you have to see the doctor. If he's not responding at home for the medication, like 1-2 days, 3 days, and he started to be have pain, fever, he cannot eat. So we have.
And sometimes there is bad smell coming from the.
Yes, bad smell. They cannot eat and they cannot swallow. So in this case, it's very dangerous. Like 1, 2, 3 days without eating or without drinking fluids, it could be dangerous for the child. So I would seek a doctor, just to see what is the problem,
yes,
and to solve it.
Okay. When you mean solve it, is that means with medication or going to the operation?
No, not immediately to the operation. First of all, we have to start with giving the child the medication. We start from step 1 to 2, 3, 4, like step by step. And the first step, we have to give him painkiller. Sometimes we have to give mouthwash, mouth gargle, and to give the mother or the father some advices for the child. And then, with this conservative therapy, if there is no response, we have to step over to the antibiotics.
Yes.
Okay. First of all, we start like orally, through the mouth, like syrup or tablets. If he's an adult, by children we give syrup, like fluids to drink. If it doesn't help, then we have to switch to the IV.
Yes.
He have to be admitted in the hospital to give him the medication in the veins.
Yes.
And then the surgical intervention,
it's the final step.
The final step, yes, right.
It's after recovery, or even it could be before.
If he's getting worse and worse and worse, we have to see if there's an infection, just an infection with abscess collection. The abscess we have to deal immediately.
Yes.
If there is an abscess, it could be dangerous for the child. It could go to the chest. So,
yes.
Chest infection, and then the abscess could be big. We have to do surgical intervention as soon as possible. It depends. The doctor, he will see the child and he will decide.
Well, that's amazing.
But I wouldn't do this at home, like with this interventions.
The traditional intervention.
I wouldn't.
Well, they call it.
In the past, we didn't have any like doctors or hospitals nearby. That's why they
need to act upon their, let's say, what's available with them.
Mashallah, we have everywhere. So
now we have clinics, we have doctors, yes, private and general hospitals. Now, there is a common misconception that after the removal operation, the immunity for the child or the adult will drop down. Is this true or false?
Yeah, it is right, but sometimes we have to. If you have like infected tonsils, the infection, they are here to save our like body.
Yes.
Okay, they are here to save our body, to produce antibodies, to protect us, to fight against the viruses and the bacteria. Okay, but sometimes they are infected, infected, and they are so swollen that the child cannot breathe.
Yes.
Or like he has an infection, so with abscess collection, he cannot breathe, he cannot eat well. So the infection is more than like 7 times a year.
Yes.
He's taking antibiotics more than 7 times a year. So they are the source of the infection then. They collected so much viruses and bacteria, and they are so, the tonsils are so swollen, so we cannot do anything else. We have to, if you have more than 7 infections a year, you have to remove the tonsils surgically.
Yes.
Okay, just to take them out, and the child,
because
you will see.
They are damaging more than protecting.
Yeah, yeah. If I have like some organs in my body are damaging more than protecting me.
Yes.
Then I have to
remove it.
To remove them, yes.
Okay. Now moving from the throat to the ear.
Yeah.
Yeah. So we know that we are in a very critical season. We have flu, we have fever, we have seasonal allergy. So let's talk about the ear. What are the first signs that there are build-up fluids in the ear for children?
Well, you see the child is not responding. You're calling him, he's ignoring you. You think he's ignoring, but he's not ignoring. He's not hearing.
It doesn't hear.
So this is the first sign. Most of them, they don't have any pain. They just, you just see the child is ignoring me the whole time. I'm calling him, he's playing with his iPad, with his phone, with the games, he's watching TV, and he's not responding.
Yes.
So after the examination, you see, oh, he had like so much fluids in the middle ear. You cannot see it. Okay, you cannot see fluid from outside.
Yes.
And after the examination in the clinic, you see, oh, the ear is full of fluids. So the first sign is he's ignoring, he's not hearing. Okay, or sometimes the children are so small, they cannot speak well. They have like speech developmental delay. Yes, and they have delay in the speech. So that's why you as a family, you have to see, okay, my child is ignoring me, he's not hearing well, he's not speaking well, so he has a problem in the ear. So I would go to the doctor to see what is his problem.
Yes.
It's just a small procedure, it takes minutes, and you know immediately if there is fluid in the middle ear or not.
But what are the causes?
The causes are mostly the upper airway infection.
Okay.
Like in the nose, in the throat, in the tonsils.
Because it's all connected.
Yes, all connected over the Eustachian tube. This Eustachian tube is connecting the middle ear with the nasal cavity and the oral cavity.
Yes.
Okay. This Eustachian tube by children is very narrow. So when they grow up, the Eustachian tube will grow up as well.
Yes.
So then we have a better drainage for the middle ear.
Yes.
So if these infections are recurrent infections in the middle ear, recurrent infections in the upper airway, and the fluids are more than 2 to 3 months in the ear.
Yes.
So I have to do a surgical step, a small procedure. It's like a half an hour procedure just to remove the fluids from the middle ear in general anesthesia.
Yes.
They sleep, okay, they don't feel anything.
Yes, for children it's general anesthesia. For adults, let's say it's...
Adults, sometimes we can do it in local anesthesia.
Yes.
But with children, I wouldn't do it in local anesthesia, because he will move.
They will move and they will be
not
nervous.
let you do it properly. So we open the eardrum, we remove it's a very simple procedure and very tricky procedure. The tubes are very small, you cannot see the tubes.
Yes.
We remove the fluids from the middle ear, and we put the tubes just to help the ear to drain the fluids from the middle ear. And immediately you see the hearing is much better. I call him,
he responds
he
immediately.
responds immediately, yes.
Okay. So you talked about the procedure. Now tell me, when you as a doctor, when you decide that this child needs to insert an ear tube, but after, let's say, you had your time with treatment and you try to go based on the standards, now you need to intervene surgically.
So I would start with medical treatment, like a month to 3 months maximum. After 3 months, if I see, I have to follow up the patient every month to repeat the test for the middle ear, just to check if there is fluids again or not.
Yes.
So after a month, 2 months, 3 months maximum, then I will see if during these 3 months I had the whole time like fluids in the middle ear. Then I would go to for the surgical intervention.
Yes.
So I would advise the family, okay, we have to stop the medical treatment or continue the medical treatment, and we have to make an appointment for a surgical for the surgery.
So based on your experience, is it based on age? Is it preferable to do it for younger patients, or based on their age and condition or the incident?
Most of the patients are young, small children, because of the anatomy of the sticking tube. They are small. The canal between the ear, middle ear, and the nose and the throat is very narrow and
so
very
they
small.
didn't develop naturally?
No, they are normal. This is normal with every child, but the fluids usually after an infection, like 4 to 6 weeks, they disappear from the middle ear.
Yes.
But in these cases, like 30–40% of the children, it wouldn't disappear from the middle ear. It will be there. And these 30% of the children, so we can wait till they grow up, but if you wait, like if he's like 5–6 years old and you wait 6 months and he is fine, he don't have any speech developmental delay, he don't have any infection in the ear, so I wouldn't touch him. But if he's small and had like speech developmental delay, recurrent infections, so I wouldn't wait. I would help him to improve better with his speech, with the infections, and to avoid like bigger infections in the middle ear, and to avoid like cholesteatoma in the middle ear, and to avoid bigger problems.
Risks. Okay. Well, all thanks to our dear guest, doctor and specialist, Dr. Mohammad Tarakmeh, ENT specialist, on his incomes and outcomes for, let's say, ear infection and throat infection. As you know, also, my dear viewers, that it is the peak season for allergies and diseases, and we need to take care of our health and, of course, our children. So let's take a break, and then we will continue with Saad.